Hello once again, and welcome to the program Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. Once again, we continue to speak on the topic of the COVID-19 pandemic. And remember, if you have any questions or comments, feel free to send us a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Welcome to our viewers, welcome to our listeners. And as usual, I am starting off this program with my mask worn properly to cover both my nose and my mouth. Any other way of wearing the mask is not correct and will probably put you at risk or put those around you at risk. For the rest of our conversations today, I will take this mask off because no one else is close to me and I am not going to put them at risk and they are not going to be putting me at risk. So to take the mask off, the correct way is to use the straps around the ears and take it off. So we continue to have questions and comments come in from viewers and listeners just like yourself. And today we will continue to answer those questions. We'll continue to make comments on those scenarios. So here are a couple of questions that were sent in from viewers and listeners just like yourself. And the first one is, does COVID cause the nose to burn? Does COVID cause the nose to burn? The second question is, should we wait for severe symptoms before getting a test? Important questions. And then the other one, it relates to children. At what age should children wear masks? And if you have little children, you will know how important that question is, especially if they're going to leave the house for any reason whatsoever. So let's address the first question about the relationship between COVID-19 and an itchy nose or a burning nose. So here are the common symptoms experienced by persons with COVID-19. The commonest of the lot is fever. This is followed by coughing, shortness of breath or difficulty breathing. Persons may have chills in association, especially with the fever. There is muscle pain, headache, sore throat, new loss of taste or smell, congestion or runny nose, nausea or vomiting, and diarrhea. So we see among the list of symptoms that persons experience acutely, as it relates to the nose, there is often congestion or runny nose. We do not see what the person asked about, which was burning of the nose. So hopefully that clarifies the common features as it relates to the nose in the COVID-19 pandemic. Those are the acute features. On a long-term basis, there are well-recognized symptoms of COVID-19, or what we call long COVID as well. These are persistent symptoms. And by far, the most common of all the symptoms that persist after an initial diagnosis of COVID is extreme fatigue. A lot of the patients who have what we call long COVID, they have fatigue. And this is described as the occurrence of symptoms or the recurrence of symptoms beyond 90 days of the original diagnosis. The other symptoms that can persist in long COVID include breathlessness, joint pain, chest pain, visual problems, coughing, loss of smell, dry eyes or dry mouth, loss of taste, red eyes, headache, sputum production, that's coughing and bringing up stuff, lack of appetite, sore throat, vertigo, muscle ache, and diarrhea. So again, in this exhaustive list of symptoms that can occur in persistent COVID or long COVID, there is no mention about burning of the nose. It is important, however, to recognize that persons can have their nose burning them for various other reasons. So COVID is not the only thing that is around. We need to understand the difference between the common things that sometimes look like COVID, and these include the flu, the common cold, as well as allergies. And if we were to examine some of the similarities and differences between these four entities, COVID-19, flu, common cold, and allergies, we see that by far there's a lot more common symptoms and among this group. But for example, in COVID-19, this is associated with cough, fever or chills, shortness of breath, loss of taste or smell, tiredness, headache, body aches, and sore throat. In the flu, we also have fever or chills. We also can have cough and body aches. You can also have tiredness, sore throat, and sometimes vomiting or diarrhea. You see there that there's not a usual complaint of loss of taste or smell. The common cold, however, there's a lot of runny nose or stuffy nose, sore throat, chest congestion. There may be some coughing, usually mild. There's a lot of sneezing and sometimes mild body aches. The one which is likely to have more effect on your nose, however, is an allergic reaction where you may have a runny or itchy nose, and that can sometimes burn. You can have a lot of sniffling, sneezing, and of course itchy or watery eyes. A lot of these allergic reactions are seasonal, and especially when there's a lot of pollen in the air, these patients can develop these symptoms, and we may sometimes confuse it with all of the other common things that share overlapping symptoms. The second question that was posed for today was, should we wait for severe symptoms before testing? And it's important to understand what we mean by testing. Right now, there are three types of tests available in Guyana. The molecular test, or the RNA, the PCR test. There is the antigen test and the antibody test. And let us look at these three. So remember, there are three tests: molecular test, antigen test, and antibody test. The molecular test diagnoses active coronavirus infection. It is done by a nasal or throat swab. It can also be done as a saliva test. Results are usually available the same day, but depending on the backlog, they can take up to a week. It is highly accurate and usually does not need to be repeated. That is for the molecular or the PCR test. The antigen test, this diagnoses active infection as well. It is done by a nasal or throat swab. Results can be ready in as little as 1 hour, and this we have available in Guyana, and this is how we're able to help with a lot of backlogs in managing our patients. Positive results are usually accurate. Negative results, however, may need to be confirmed with a molecular test, and this is particularly so if the patient's symptoms suggest COVID-19, but the test comes back negative. You would want to then make doubly sure if this is actually negative. The antibody test, this is the one that shows you if you have been infected in the past. It is usually done by a finger stick or a blood draw, the same way you would do your blood sugar levels. The results can be the same day or up to 3 days. And sometimes a second antibody test is needed for accurate results. So those are the three tests that are available in Guyana. I am certain that there are other types of tests that are being actively worked on and being developed so that we can have more accurate and timely results to manage these patients properly. So if we were to summarize the types of COVID-19 tests and you were to ask, am I actively infected with SARS-CoV-19? Or the active infection is revealed by the nucleic acid or molecular test, that is the PCR, or the antigen test. And those are the two tests that would answer the question of if you are actively infected. The third test that we have basically answers the question, was I infected in the past? This is the serological or the antibody test. So the best time to test depends on the type of test that you are doing. If you were to look at the natural history of what happens in COVID-19 infection, from exposure, which is considered day 0, if one were to count that, you would see that the time to detect the actual virus is best between day 3 to day 14. Before that, it's very unlikely that you could actually detect the virus. The best time generally to detect antibodies would be after the first week into up to the third week. And that is what would tell you that you have been infected sometime in the past. But if you're going to test for active infection, the best time would be between day 3 to 4. And if you were to look at this again in terms of the number of days from exposure to testing, if we consider again day 0 as the first day of exposure, the most accurate testing window is between day 5 to day 8. And by then, most persons who would develop symptoms would have already developed symptoms between day 5 to day 8. What do you need to know about the COVID-19 testing? There are two main groups, the diagnostic swab test and the antibody test. The diagnostic swab test determines the presence of the COVID-19 virus. The antibody test determines previous infection of the COVID-19 virus. Who should get it? If you have symptoms like fever, cough, and trouble breathing, you should get the diagnostic swab test. The antibody test may be recommended by your healthcare provider if you have these symptoms. The diagnostic test is done by nasal or throat swab. The antibody test is by a blood sample. And what do you do if it's positive? If the diagnostic swab test is positive, you rest at home and self-isolate to avoid spreading COVID-19. If you test positive for the antibody test, it means that you have developed antibodies against COVID-19 virus. This does not, however, mean that you are protected against being infected again, because we have had several cases of persons having second types of infection. They would have COVID one time, they recovered, and then get it again. The third question that we will seek to answer today relates to the wearing of masks by children. What age should children wear masks? And we look at the guidelines as set out by the WHO and UNICEF, which says that children aged 5 years and under should not be required to wear masks. That's probably because it's difficult for them to keep it on. This is based on safety and overall interest of the child and the capacity to appropriately use a mask with minimal assistance. Children 12 years and over, however, should wear a mask under the same conditions like an adult. Now, for children age 6 to 11, this is where the recommendations are a little bit different from the first two categories. Whether there is widespread transmission in the area where the child resides, that is a consideration to determine whether or not this child should wear a mask. So these are children who should wear. You should also consider the ability of the child to safely and appropriately use a mask. The next thing to consider is the access to masks for the child, as well as how do they keep it clean and the ability to replace the masks in certain settings, especially in schools and childcare services. Again, this gray area of children between the ages of 6 to 11, they require adequate adult supervision and instructions to the child on how to put it on, take it off, and how to safely wear the mask. The potential impact of wearing a mask on learning and on psychological development in consultation with teachers, parents, caregivers, and medical providers must also be factored in. And the other considerations is that in specific settings and interactions the child has with other people who are at high risk, that also can determine whether or not this child should wear a mask. So hopefully we would have answered 3 questions that were posed by viewers and listeners just like yourself. And remember, if you yourself have any questions, please feel free to send a WhatsApp to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining me today, and see you next time.